Well, hello. Just as we had thought that the story of COVID was almost over, we now stand for some parts of India at the threshold of the second innings, and for some other parts of India, we are almost in the center and the middle of the second innings. Before we dwell on some of the important aspects of the second wave of COVID, let us remind ourselves about the first wave. 24th of March, we went into the noisy, abrupt, scatterly planned lockdown, which lasted for, depends upon your definition of the lockdown, which lasted for something like 68 to 75 days. It did not flatten the curve of the disease, it flattened the economy. But still, an argument can be made that if we had no lockdown at all, things could have been much worse. But wherein did we have the actual benefits of the lockdown? From a public health perspective, it's a bit difficult to comb out those figures. How long did the first wave last in India? Well, at a conservative estimate, if you are a little bit miserly, you can say 200 days. If you are a little bit liberal with your time scale, you can put it to 220 to 230 days. And this first wave, which accounted for more than a crore of victims and more than a crore of infected patients and more than a lakh of victims, was probably twice as long than the conventional first wave, which happened in Europe, North America, United Kingdom, Russia, with the exception of Brazil, because which, a little bit like India, it is a story unto itself. Now, why did the first wave last that long in India? Because India is a huge landmass, and when we plot the graph of incidence of India, we are actually taking a kind of summation of what is happening across this huge landmass. And as we remind ourselves that this wave had actually started in the west, crawled its way to the north, made its way to the south, and just as when the east was thinking that we had escaped from the onslaught, we fell right into the whole thrust of the pandemic as well. How did we do for healthcare capacity? There was a tremendous congestion in healthcare capacity in almost every major city of the country, and that was more out of A, bad planning, and B, out of the fact that most of the major hospitals had kind of segregated themselves into COVID and non-COVID in such an ill-planned way that there was a clutter, there was a queue, there were congestion, there were allegations that people had died because of lack of bed, in a situation where there is no evidence in front of us that any major city had ever used more than 60% of the healthcare capacity it had. So it is a kind of a paradoxical figure that why do we claim that we were overflowing with patients when we had but used about half or 60% of the capacity, and there was not much happening elsewhere. During the entirety of the first wave, people were stuck at home. There was no trauma, there was no heart disease, there was no cerebral stroke. The poor cancer patients didn't even seek out to get their treatment. So, what were we exactly saving ourselves for remains a point in question. There was tremendous drama about ventilators. Almost everybody who had a kind of half-baked lathe machine got into the act of making ventilators somewhere in the month of April and May, and they got themselves their two-bit in the national and the local media. At a conservative estimate, India has about 40,000 ventilators. And once again, there is no evidence that we ever ventilated more than 15, 16,000 patients on any given day. So, this whole business that we were building up healthcare capacity and building up technical capacity is a myth that should be laid to rest. Yes, Indian healthcare is underprovided, it is marasmic, it is very ununiform in its distribution and in its capability. But there is simply no way that in a matter of, say, 100 days of lockdown or within a month of lockdown, you can suddenly beef up Indian healthcare, which has been sort of neglected and been low down on national priorities for more than 7 decades. So, in this mass of anachronisms and contradictions, we crawled out of the first wave. And depends, we had our worst 2 weeks during the first 2 weeks of September. Thereafter, in different parts of the country, there was a tremendous amount of resilience and public awareness shown in the east during the Durga Puja period. Even Diwali people were fairly well restrained in the north. And even though we had a barrage of public festivities there, we managed to sort of smoothen out the first wave from about the beginning or the middle of November. India had a privilege, and that privilege was that by the time of November, December, it was amply clear to everybody in the world that a vaccine was coming. There were vaccines like the Russian, the Sputnik, the Oxford, AstraZeneca, Covishield, India's own vaccine, Covaxin, Pfizer, Moderna, Sanofi, Johnson & Johnson. Everybody was creating a buzz that vaccine was coming, and by December, many of these vaccines were presented to the various national authorities in US, UK, India for their approval. And in this period of time, it was amply clear that India was in a position of privilege. And that position of privilege was that we were the only major country who were given the opportunity to vaccinate as fast as you could during the waning phase of the pandemic. Did we take up the opportunity? I cannot say yes. The approval for vaccines was given on the 2nd of January. It could have jolly well have been given in the middle of December. What were we waiting for? There was tremendous amount of lack of clarity at the drug controller CDSCO level. Like we say in Hindi, pehle aap. So the Indian drug controller was waiting for somebody else to do the job. And essentially we still had the colonial hangover, and we were waiting for United Kingdom to wave the first flag at Covishield. And within 24 hours of the British giving their approval for Covishield, we just said, Jo Hujur, we'd go ahead and do the same, and we did it. That is a little bit inexplicable. And having given the approval in the 2nd of January, we wasted 2 entire weeks and did not start vaccination, till the 16th of January. That is confounding. Why did that happen? Critics would tell you that because some minister who is a little bit more mythological than epidemiological wanted the Sankranti period to get over. And yet others tell you, we were building up our infrastructure, we were preparing for vaccination. What the hell were you doing from June 2020? It was obvious to everybody that a vaccine would be available come December 2020 or January 2021. You just did not know which particular vaccine is it going to be. We knew very well it is not going to be an oral vaccine, it would be an intravascular vaccine. We knew the number of states in the country, we knew the population of the country. So how come we had to waste 14 days between 2nd of January and 16th of January to actually start vaccinating? Absolutely confounding. In those 14 days, something like 1.5 crore of our people, by a conservative estimate, could have been vaccinated. And by this time, by January, it was getting amply clear that Mumbai, which was completely preoccupied with a hero and a heroine and a drug case during the first wave, that during the second wave, Mumbai always has a reason to get distracted. And during the second wave, it was the case of a car which was parked in front of the house of a mega millionaire, and Mumbai focused on the safety and security of one person, one family, rather than the safety and the security of the whole country. They were so distracted that a second wave that had actually started from a couple of districts of the states could not be contained. They allowed this second wave to spill over to Nagpur, to Pune, to Mumbai with obvious consequences. So within a few weeks, you had cases popping up like popcorn all over Maharashtra. I believe Maharashtra, the Shiva Sena, has not yet managed to build up enough RT-PCR labs, facilities. The public health is a little bit weaker than the razzle-dazzle of Bollywood or the numbers that are churned out from Dalal Street and Sensex. So there is a huge gap between the money greed of Maharashtra and between the public health and public governance systems of Maharashtra. And what the central government and the state government, in their combined callousness, failed to quarantine Maharashtra or Mumbai or Nagpur from the rest of the country. And thereby, the entire scenario, the entire march of corona that we had seen during the first wave, which is west to north, north to south, south to east, I think the same sequence of events stands to be repeated all over again. And the only difference between the last time and this time will be the presence of vaccine. We were going around an absolute leisurely method during the first 2 or 3 weeks. There was no reason whatsoever as to why we had to waste one whole month in trying to vaccinate a largely reluctant healthcare professionals. Along with healthcare professionals, the other high-risk categories could have been started, could jolly well have been started in the first month. We could have vaccinated the healthcare frontline workers along with the above 65 or the above 70 at the same time. So the entire first month, the rate of vaccination was absolutely pathetic nationwide, somewhere around 5 lakhs a day, 7 lakhs a day, 4 lakhs a day. In some states are also alleged to have wasted vaccine during the first 1 month. And after the end of the first month, when from the 1st of March, a month, more than a month, when from the 1st of March, the vaccination age bar was brought down, the speed picked up a little bit, and currently, over the last fortnight or so, we've been clocking at around 20 lakhs plus a day. And if you consider the fact that what was our target, what was the national deadline, the national target? The national target was to reach 30 crores by about June, July 2021. Are we anywhere near 30 crores in June, July 2021? We are very sorry to say we are not. So at the going strike rate of even 20 lakhs a day, I think somewhere in the end of June or beginning of July will be we would have done well to have reached about half that target. And again, very confusingly, we went on exporting vaccines for most of this 2.5 months. We couldn't save our own people. And we are trying to play the international idol reality show by exporting vaccines to other parts of the world when our own people were right in the middle, were right in the beginning, unmistakable signs of the second wave coming on. How is healthcare delivered in India? 75% of healthcare in India is delivered through the private sector. How are medicines delivered in India? 90% of all pharmaceutical delivery is through the pharmaceutical shops at your street corner, which are littered all over the country. So you cannot pretend to change the healthcare distribution pattern overnight. So if we ever wanted vaccination to reach to the people it ought to reach, it was jolly obvious that we had to have enough stock, and that enough stock had to go out through the private distribution system. Somewhere down in the middle of it all, better sense prevailed, and vaccination was handed over to the non-governmental hospitals, to the clinics, to some of the larger diagnostics, and thanks to that strike of wisdom, to that spark of wisdom, that vaccination reached from 5 lakhs to 20 lakhs or 22, 23 lakhs. And we are not going to be in a position to vaccinate the desired population. The desired population of India has to be much below 45. It has to go down to 20, 25 years of age, because that is the average age of a person who works in India. That is the age of a person who goes to the schools and colleges, who are out there to keep this limping economy running. We cannot pretend like the rest of Europe or North America that if we vaccinate somewhere around the 40s, we will be enough. It is not a matter of demography, it is a matter of functional demography. And if we consider the functional demography in India, without a shadow of doubt, we have to get the vaccination down to at least the 20-25 age group. And for most part of what we have seen so far, from 16th of January till about the end of March, around the cities, the people who are actually conscious, the people who are actually aware and coming for vaccination is tending to be the working population, the middle class, the upper middle class population. I'm not trying to inject a little bit of classism and elitism in this, but I'm trying to say very unambiguously that vaccination cannot be an elitist persuasion. For vaccination to be effective from the public health standpoint, the slums, the lower middle class, the congested areas of the cities, of every major city in India, of Delhi, Kolkata, Mumbai, Mangalore, it is the slum areas, the congested areas, the people of these areas will have to be vaccinated. And for the people of these areas to be vaccinated, A, we have to have enough stock, and B, the vaccine has to reach the people. The people will not be in a position to come out to get the vaccine, because these poor souls have just come out of starvation for more than 6 months. So the entire vaccination campaign needs to be rebooted in terms of its capacity, in terms of its speed, and how it is reaching the people. Very sad to say that almost an equal number of fallacies have characterized our public health approach from the policy point of view to the second wave, as we had seen for the first wave. But the only difference during this period of time in 2021 is availability of vaccines. As scientists, virologists, public health people will tell you that we are in the middle of a race, we are in the middle of a slog over, and in these slog overs, in this race, the game will be decided by the relative speed of the variants and the vaccine. I'm not getting into the intricacies of the variants because, mind you, in public conversation there is a little bit of difference between variants and mutations. But whatever it is, yes, viruses will naturally mutate, there will naturally be variants, and we have to get our population resistant to the current batch of viruses so that the transmission is minimized. And if the transmission is minimized, then the pandemic naturally comes to a faster decline. And to all of you who will be watching this video, please take home with you one message. What is a vaccine? A vaccine is like the seat belt of a car. The seat belt does not prevent an accident. The seat belt minimizes the trauma, minimizes the damage that we suffer from an accident. So just like when we hit the road, we have to drive safely. Similarly, till such time our vaccination reaches to everyone of the country, everyone eligible in the country, we have to keep up with wearing a mask. We have to minimize all non-essential activities. Getting out to work, getting out for public communication will have its own hazards, and in the current frame of things, that will be unavoidable. But all of us will have to avoid non-essential gatherings, marriages, parties, Holi, etc., what have you. So non-essential congregation, non-essential travel, non-essential gathering will have to be avoided. And I have no shame in admitting that in the Indian framework of life and living, social distancing for most parts is a big joke, and it's a cruel joke. We can maintain social distancing within the comforts of a posh office, from a very well structured sort of private school, college, office infrastructure. But in the rest of public gathering, it is a joke. And if one set of people have completely violated the public health norms, that has been our famous politicians. And who else knows this better than me, a hapless Bengali, caught within the Olympics of democracy for over the last 2 months? Those of you who have seen the ruthless pictures of how these Goliaths of politics have went around their road shows and rallies and what have you, absolutely should hang your head in shame. And lastly, once again, do not take comfort in the fact that India had a low mortality rate during the first wave. We had a low mortality rate because the healthcare responded. The doctors, the nurses, each and every simple healthcare worker, they fought it out. We had a low mortality rate because our people were aware. The people responded far better than the policymakers. And again, do not fall for the policy that we have a young population. Because we have a young population only because we have a fairly lousy healthcare system. If the birth rate has been constant for the last decade, then we continue to have a young population simply because the healthcare system in its entirety cannot look after the people who are more than 60, 65 years of age. Because if our healthcare was as good and as efficient and as comprehensive, then within the last decade, in our demography, we should have had a larger proportion of people who were in their 50s, 60s, and 70s. And those people who lost their lives, that lakh and a half that we sacrificed during the first wave, and we continue to sacrifice right now at the rate of 250 to 200 lives per day, 90% of them, friends, are people who are in the prime of their lives. People who were keeping a family going. People who were the mothers and fathers, the breadwinner, people who kept the whole familial structure together. So the number of people who died in the first wave or during the first instance cannot be a comfort factor at all. So at this stage, we need to keep our guard. We need to spread the word around everyone you know that please, everyone who is eligible, go and get vaccinated. Every vaccine that we have available is going to be effective. And before I close, I make a plea once again to the big priests of public health care, governance, and the permission-giving authorities of India that please make more vaccines available. Sputnik, which has a manufacturing arm in India, is now waiting for approval. The approval is long overdue. Please get outside the narrow-mindedness of vaccine politics. If more vaccines are made available, more people can get vaccinated. Both the people and the vaccine manufacturers are more political than politicians themselves. So do not fall a prey to the vaccine politics. Make every vaccine that comes with a backed up data. Sputnik has come up with very strong data. There is no reason at all why Sputnik is not being made available for distribution in India. So more the vaccines, more is the level of protection. And let us all remember that there are three key words in the middle of this second wave, and that is vaccine, vaccine, and vaccines. God bless us all. We need it. We need it badly. Thank you.